So you've seen the name around, or maybe even the machine, the Da Vinci machine, and here to tell us all about it is Dr. Missanelli. Thanks for coming in.
Thank you for having me. It's nice to talk about the robot any day.
Yeah, it's sort of a mystery out there for a lot of people, and some people might not even know it's here, which is a tragedy in itself, because this is cutting-edge stuff.
It is, and what you say is true. It takes a long time for something to get known in the community. That's what we're trying to get people to understand, is that this small South Lake Tahoe community, the medical community, has the best and the most advanced surgical instrumentation that you could get anywhere in the world, and that's the Da Vinci robot.
I mean, you have to, with all these top-notch athletes around here, and they really do a lot of cutting-edge things, and this is one of them. What do you use the Da Vinci for?
Well, I'm a gynecologist, and I came to South Lake Tahoe from San Diego because I was the busiest benign GYN robotic surgeon on the West Coast, and I came here because this administration at Barton Hospital has made the commitment to make the robotic program as big, expanded, and robust as possible, and so it was exactly what I wanted to do. I do all GYN surgery. Haven't done an incision for a woman for any surgery since November of 2009, and that's the point. We can do anything that we used to do in GYN surgery with the robot.
Wow, that is not an incision since 2009.
Correct.
That is awesome. And even a quick fact from Dan Kerr, head of the Barton Blood Drive, he said you guys are using less units of blood at Barton due to this exact machine because it's less invasive.
Less invasive, but also this. It magnifies whatever you see in surgery by 10 times. So you can actually see the blood vessels that you normally would cut and would bleed before all of that happens. So you're able to preemptively eliminate the amount of bleeding.
Oh, wow.
That's part of why the whole technology is so much better than someone standing at the operating table with just glasses like me trying to do the surgery.
Right, right. And there's no one particular person that is, I mean, everybody could use this. It's a crucial part to any surgery.
It is. All the specialties can use it, have used it. When I go to international conferences for robotic surgery, the GYN part of it, the gynecology part of it, is small. Lots of other specialties are now getting into it, including neurosurgery and heart surgery.
Wow, wow, that's huge. I mean, for them to do that, I mean, that's awesome. What are some of the specific procedures that you perform?
Well, you know, the most common operation in the world is hysterectomy. That is actually second to cesarean section, but that's on the obstetric side. So that's what I see mostly. There's so many indications for women to not have their uterus, to ask to have their uterus out, that hysterectomy becomes the most common procedure that I do with the robot. But close second to that are procedures that help with pelvic floor prolapse. Women, as time goes by after having babies and other indications, have such a relaxation of the bottom part of their body that we have procedures with the robot that can fix that and make them have a permanent life of no leaking and no symptoms of any kind. So that's the second most common thing we do, but everything else comes with it.
All right, so if someone is in need or they feel they might be in need, how can they get more information?
They need to just contact my office and we'll direct them in the proper way, or call Barton Health or text bartonhealth.com. The phone number is 530-543-5711. We'll help them with every step of what they need to know after that.
We really appreciate it. It makes a big difference. Thank you, Dr. Missanelli. That's going to wrap up this interview. We'll be back after this quick break.